Hi, this is Scott Sicherer, Associate Editor at Journal of Allergy and Clinical Immunology. I'm here with Carolyn Roduit, who is a pediatrician and research fellow at the Department of Allergy and Clinical Immunology in the University of Zurich Children's Hospital. Thank you for joining us today. We're going to be talking about your paper entitled Increased Food Diversity in the First Year of Life is Inversely Associated with Allergic Diseases. Now, there were some early studies that said that when babies were given a higher number of different foods early on, they were more prone to atopic dermatitis. And you have previous studies showing, the opposite. So tell me about what this study was looking at.
So first, as you said, there are currently a lot of studies looking at introduction of food in early life and allergic diseases, but very few looked at food diversity, and most of them did not find an association. As you mentioned, one study found that there was an increased risk of atopic dermatitis among children having an increased food diversity in the first 4 months of life. But most of these studies, they focused at the first 4 to 6 months of age. And in our study, we looked at the food diversity in the first 12 months of age and the association with allergic diseases. And as you said, we already reported that an increased food diversity in the first year of life might prevent against atopic dermatitis.
So what were your main findings in the current study?
So in the current study now we use the same birth cohort study with about 800 children for this analysis, and we looked at this food diversity in the first year of life and other allergic diseases. And what we found is that children having a high diversity of food in the first year of life had a decreased risk of developing asthma and also decreased risk of developing food allergy and sensitization to food allergens. And we observed that we had a linear association between this increasing the increased food diversity in the first year of life and the decreasing risk of asthma and food allergy. But with allergic rhinitis and sensitization to food to inhalant allergens, we did not see any association.
Okay. Now, we often worry in studies like this about something called reverse causation, that maybe the families that were at higher risk to begin with would be more cautious, and then it would end up looking like a narrower diet was a bad thing and a diverse diet was more protective. So how did you address the possibility of reverse causation in the study?
Yes, exactly. The reverse causality effect is a very important point when we looked at nutrition, especially in early life and allergic diseases. And in our study, we found that children having parents with allergy had a lower diversity in their diet in the first year of life compared to children having parents with no history of allergies. So this could really lead to a bias due to this reverse causality effect. So we really tried to address very carefully this point in our study, and for that we did a lot of additional analysis. And for example, we stratified our analysis depending on the allergic status of the parents, and among children having parents with allergy, and also among children having parents with no history of allergy, we found a very similar effect. And also we did additional analysis excluding children having already symptoms of allergic disease in the first year of life, like children having food allergy or children having asthmatic symptoms. And here as well we found very similar results. And the good things that we have in this study is that we have a question in the first year of life where the parents had to report if they avoided the introduction of food in the first year of life due to the child's allergy. And also excluding these children from the analysis, we also found very similar results.
So you covered it in multiple ways, and
yes,
it sounds like you took care of that.
But of course, this is an observational study, and to really completely exclude this reverse causality effect, then we need a randomized clinical trial.
So, there have been all types of advice for parents about how to prevent allergy, and so what do you think the take-home point is on this study? It gets very confusing for families and for physicians trying to decide what to tell people.
I think what we can say now is that nutrition in early life might be a very important factor regarding allergic disease. But regarding the food diversity, I think this is one of the first study that showing that an increased food diversity in the first year of life might have a protective effect against allergic diseases. So I think before we are able to really make recommendation, we will need some more studies looking at this food diversity, and maybe especially looking at the first 12 months of the first year of life, and not just focusing on.
So, but it sounds still that this is one more nail in the coffin of the old ideas of, at least in the United States, we would say years ago, don't have highly allergenic foods, have very few foods if it was a family at risk for allergy. But it sounds like this is more evidence that if you have an otherwise healthy child, having a healthy and diverse diet may be just fine.
This is correct. Yes.
Well, thank you for the great work that you've done. This is all very interesting, and it's a very important area of research for public health and for us to figure out really what to tell our patients. So thank you.
Thank you very much, Dr. Sicherer.